Dear students, welcome back. In the previous session, we have discussed about electrical stimulation of nerve and muscle. On the basis of previous discussion, the muscle can be stimulated by Faradic current. That too, innervated muscle is stimulated by Faradic type of current. Okay, so what are the physiological effects of Faradic type of current? Now we will see in this discussion. Okay, so the tissues of the body are capable of transmitting an electric current. Why? Because the tissue fluids contains ions. So these ions acts as conductors. So therefore, the current passing through the body consists of a two-way migration of ions, and the conductivity of the different tissues varies according to the amount of fluid that they contain. Muscle, for example, muscle has a good blood supply and so it acts as a good conductor, while fat is a poor conductor. Okay, so the current tends to travel through those tissues which have a low resistance, although it is not always possible for it to avoid the high resistance layers. As we know that our body consists of superficially skin, and then we'll have the subcutaneous tissues, that is superficial fascia, and then deep fascia. Further we will reach to the muscles, isn't it? So all these layers may act as high resistance layers. Out of these layers, the epidermis, so we are applying all these electrical stimulation is a non-invasive methods. Okay, so the epidermis has a high resistance, that is 1000 ohms or more. So as it contains little fluid and the superficial layers do not readily absorb moisture, the current must pass through the epidermis, and appropriate measures are used to reduce its resistance while applying electrical treatments. Passage of current may result in chemical changes which can constitute a danger, that is which causes some burns in some treatments. Okay, so now we will see what are the effects of the Faradic type of current on different structures. One is the first one, physiological effects we are going to discuss is stimulation of sensory nerves, and then stimulation of motor nerves. What are the physiological effects? Okay, and then effects of muscle contraction. What happens, what is the physiological effect if you stimulate a denervated muscle, and what are the chemical effects of this Faradic type of current in this session. Now first we'll move on to the stimulation of sensory nerves. When a current of Faradic type is applied to the body, a mild prickling sensation is experienced. So this is a spinal nerve. Okay, spinal nerve which is consisting of dorsally sensory root and ventral, that is anteriorly it consists of motor one. Okay, all these two unites to form a spinal nerve. Okay, so whenever you stimulate a sensory nerves, so it will experience a mild prickling sensation. So that sensation is carried out by the sensory nerves of the spinal nerve, and finally it is reached to the brain, to the sensory cortex. Then we can feel it as a prickling sensation. Okay, so this is due to the stimulation of the sensory nerves, and it is not very marked because in the Faradic type, because the stimuli are of fairly short duration, isn't it? Faradic type is a short duration type, of currents, the sensory stimulation causes a reflex vasodilatation. So this causes vasodilatation on the skin. So vasodilatation of the superficial blood vessels. So when we remove this electrodes, at that point you can find some reddening of the skin called as erythema. So the vasodilatation is generally confined to the superficial tissues only, and it is having a very little practical importance. Okay, so now we'll move on to the stimulation of motor nerves. So a current of the Faradic type stimulates the motor nerves. So here you can see the motor nerves, what happens. And if the current is of sufficient intensity, stimulation of motor nerves, if current is of sufficient intensity, causes contraction of the muscles. So here you can see causes contraction of the muscles which they supply. Because the stimuli are repeated 50 times per second or more, then what happens? As we already discussed in the previous session, the contraction is tetanic. Okay, in this type what happens? We can find only contraction, but there is no time for the relaxation of the muscle fibers. So in this type of contraction is maintained for more than a short period of time. Further, muscle fatigue is produced because there is no relaxation is taking place. So the muscle is going to fatigue. So the current is commonly surged to allow for muscle relaxation. Okay, when the current is surged, the contraction gradually increases and decreases in strength in a manner similar to a voluntary contractions. So this is about the stimulation of motor nerves. Now we will move on to the effects of muscle contraction. Okay, so normally this muscle contraction, so we are stimulating the muscle. What are the results of this muscle contraction? Okay, so when a muscle contracts as a result of electrical stimulation, the changes taking place within the muscle are similar to those associated with actual voluntary contraction. So when you stimulate the muscle, so there is an increased metabolism. So once the metabolism is increased, what happens? There is an increased demand for oxygen and nutrients and an increased output of waste products, which includes metabolites also. The metabolites these metabolites or the waste products cause dilatation of the capillaries and arterioles, and there is a considerable increase. So if the arterioles and capillaries are dilated, what happens? So the blood flow inside these arterioles and capillaries are going to increase. That means which leads to increased blood supply to the muscle. Okay, so this is so by the stimulation of the muscle which causes increased metabolism. Okay, so if metabolism is increased, so what is the result of this stimulation finally? So the muscle is going to contract and relax, isn't it or not? Yes. So if muscle contracts and relax, what is the use? Isn't it? Yes. So after electrical stimulation, the muscle is going to contract and release. So then what happened? So there exists a pumping action on veins and lymphatic vessels lying within the muscle and around them. Okay, so the walls in these vessels ensure that the fluid they contain is moved towards the heart. That means which increases finally the venous and lymphatic return. Okay, so finally if you see some of the therapeutic action, Okay, so because of this contraction, it reduces the swelling, because the fluid around the muscle, around the tissues or within the muscle, are going to pump towards the heart, isn't it? So these are the effects of muscle contraction. So what happened if you stimulate a denervated muscle? So here, this is a muscle which is supplied by this denervated. So here there is a complete cut of nerve that is called as neurotemesis. If such kind of nerve is supplying this muscle, that is called denervated. So here we can't get any nerve impulse from the neuron to the muscle. Okay, so the current required to produce a contraction of denervated muscle with an impulse lasting for 1 millisecond is usually too great to be tolerable for treatment purposes. So the Faradic type of current is therefore not satisfactory or not used for the stimulation of denervated muscles. If you see the chemical effects of the Faradic type of current, when a direct current is passed through an electrolyte, okay, chemical changes takes place at the electrode. So at the electrodes, anode and cathode and anode. So what is happening at the placement below the electrodes? There is a chemical change. So if the chemicals formed come in contact with the tissues, there is a danger of electrolytic burns. Although the danger is appreciably less with an intermittent than with a constant direct current. So normally the constant direct current will have more danger of this electrolytic burns. So if you use intermittent currents, then we can reduce the burns. When the current is alternating, the ions move one way during one phase of current and in the reverse direction during the other phase. And if the two phases are equal, the chemical forms during one phase are neutralized during the next phase. However, the reverse wave of current is not similar to the forward wave. There are chemical changes which would cause an electrolyte burn. Still, it causes electrolytic burn if it is an alternating type of current. Okay, so if you can see in the iontophoresis, so the current obtained from electronic operators may have a greater flow in one direction than the other, but if the impulses are of very short duration, the chemical formation should not be great enough to give rise to a serious danger of burns. However, it is advisable to take appropriate precautions. So these are all about the physiological effects of Faradic type of current. In the next session, we are going to discuss about the therapeutic effects of the Faradic type of current. Thank you.